Hello, my name is Srinidhi Acharya and I am participating in this online hackathon for the first time. So, let me start explaining what my project is. I have worked on developing an AI powered medical transcription system that helps to convert the conversation between the doctor and the patient's conversation into a more structured summary by making use of Gemini speech to text API and biomedical NER models, because of which it helps to reduce the manual documentation work that the doctor does after he has done interacting with the patient by over 70%. As you can also see that I have built an interactive review interface by making use of React.js, which is a popular UI library that enables doctors to validate the AI extracted medical terms and helps to generate professional PDF reports. So without further ado, I'll just run the entire application and tell you what results it produces. So I have the backend running over here. The entire backend is coded by making use of Python and Fast API. The backend is currently running on localhost 8000 port, and this is my front end, which is running on localhost 5173 port. Now, once the doctor has completed his conversation with the patient and the patient has gone, the doctor now has to like manually enter his conversation details regarding the medication, the symptoms, the prescriptions into his computer or any application that they use. Instead, what they can do is once the patient has gone, the doctor can write a quick summary of what he has deduced by talking with the patient, and he can record his audio conversation, and then he can upload that audio file to this application. So over here you can see that I have this uh, Srinidhi.wav file, and it is my audio file. This is a sample file, and I'll open this and I'll click on get summary. Now the backend will work on summarizing whatever conversation is being done by the doctor with me. And you can see that there are two entities over here. First is the conversation highlight, and the second one is insights extracted by the AI. So for the conversation highlights, it's the patient John Doe. I did not change the name of John Doe with myself, so it will actually be my name, a patient Srinidhi, 45 years old. I'm not 45 years old. Presenting with chest pain for 2 days, and the ECG shows mild abnormalities. Prescribing aspirin 75 milligrams daily. So this was the conversation highlight that the doctor had with the patient, and on uploading this summary to the on uploading the audio file, some of the insights that was generated by the biomedical NER model by the application gave me all these values. So there is age, biological structure, sign, symptom, then duration, diagnostic procedure, severity, medication, dosage. Now over here, the doctor has a choice. He can see and decide, okay, are all these details correct or not? If it is not correct, what he can do is he can instantly edit the details. For example, the duration here mentions 2, but it's not 2, right? It's 2 days over here, like 2 days. So they can click on this edit button, and instead of 2, they can have 2 days. When I click on OK, it's like okay, the 2 days is now edited, the 2 is edited to 2 days. And suppose they want to change the name of ECG from lowercase to uppercase, so what they will do is they will write capital uppercase. And once they are sure that okay, all the data extracted by the AI is now correct, they will click on the submit details correction button, and then they will click on the download PDF button. So I have this patient report 1. I'll click on save, and let me quickly view if my details are being reflected in the PDF generated or not. So I made two changes, that is 2 days, the duration which was changed from 2 to 2 days, and then the diagnostic procedure which was changed from lowercase ECG to uppercase ECG. And in this PDF, we have three types of data. We have the medical, we have the title, that is medical report summary, and when it was generated, that is today's date and time, what the summary was, and what were the corrected extracted medical entities. Now the doctor, they can, after now the doctor, they can directly upload these documents to their electrical historical records, and the problem of manually documenting, which is mostly error prone, is now solved by using the doctor patient audio summarizer. So as I told you initially, what application I have developed and what problem it solves. It is basically helping the doctors to reduce the manual documentation time by almost for 70%, and it allows the doctor to spend more time with the patient rather than spending time with the documentation. So that was all about my project. Thank you so much.